guys from Yorkshire Poochie Therapies. That's me, and these are my dogs, Lily and Peggy, and we're going to talk about Photizo. But we're going to talk about Photizo for Luxating Patella. Of course, Rodney wants to get in on the action, but actually we need to borrow him back again. So we are looking at this joint here when we are looking at Luxating Patella. So this is the dog's stifle, or basically their knee. So Luxating Patella occurs when the kneecap comes out of that trochlear groove on the front of the femur. So let's have a look at what a routine looks like for Lily. So we're going to start furthest away from the painful area. So we're just starting in between the shoulder blades. This is going to be a really nice way to gently introduce your dog to Photizo, to an area that's potentially uncomfortable. Here, Lily's not sat down. She's not sat down. Put my teeth back in. She's not tied up. She is just sat down. And I'm gradually working my way down the spine. The reason that is important is because compensatory tension travels across the body. So if we have an issue, say, in the right hind limb stifle, that pressure will then go into the pelvis, up the lumbar, so that's the lower back, and travel diagonally across. And then during my educational talk, we had a break in. So now we'll get back to it. So with Lily, I'm applying 3 acute doses into each area, but obviously these videos are sped up, and I'm just giving her a little tickle on the chest, just encouraging her to stay kind of put. Oh, quick magic cameras changed there, and I came a little bit closer to show you a little bit better what I was doing in this stifle. So we've gone down the back, and now we are looking to work around that knee. So I've gone on the front aspect of that knee, and then I've just kind of reversed my way back up to the pelvis. The joy with Photizo is that you can use it intuitively. What that means is let your dog tell you where they want to be worked on. You can see that Lily's kind of leaning into that Photizo pressure a little bit. You can use the Photizo without pressure, like completely without pressure, but sometimes dogs like a little bit of pressure into that area. If we encourage that capillary closure, it means that when we remove the Photizo, ooh, spinning dog, when we remove that Photizo, it's going to allow extra blood flow into the area, obviously if your dog consents. So you can see that Lily's changed positions, and I go back to that front aspect of the stifle or the knee, and I'm just working a little bit further down. Again, I'm just supporting Lily by giving her some little tickles, and my aim is to put 3 doses, acute doses, into each aspect of the joint. So imagine like a full 360 around that entire joint. I'm aiming to get 3 doses into each area. So obviously this is going to be different depending on the size of your dog, but Lily's really tiny. She's like 6.5 kg. So for her, the panel of the Photizo covers near enough the entire front aspect of her patella. And I'm just adding in a little bit of massage technique. Now, notice how Lily is ever so slightly starting to get fidgety, and there's a reason that I didn't re-record this footage, but basically Lily decides to opt out of Photizo. I don't know why, but it's her choice. So we're going to watch as that unfolds, because I think it's important for you to see that when you are doing this at home with your dog, or you're doing it in a professional setting, listen to your dog. Now, the area that I'm going over kind of, so if we follow just behind the rib cage, we're looking at the iliopsoas area, and that is an area that Lily does have strain. So whilst I'm working on the stifle with the Photizo, I'm also using a little bit of hands-on work. So she offered me, oh, she had a bit of fluff on her foot then. It's typical working in Yorkshire Poochie Therapies clinic that someone else's dog fluff will end up on your paws. But anyway, so she's rolled onto her back and she stretched out that limb I was working on, and has allowed me to work on the inside aspect. Now, Lily is very well fared with Photizo. Some dogs may not be comfortable with you doing this straight away. It might be something that you have to work up to. But whilst I'm working on the Photizo, I'm doing some hands-on work because I'm a canine massage therapist. I just can't help myself. But Here we go. I'm just doing a little consent base check with Lily. I gave her a little pause there, but we are in 2 times speed. So I'll give her a little tickle. But remember, your dog isn't, tethered in any way, shape or form. And Lily isn't either. So she can opt out, which she does in a minute. So she's going, not really sure. A little bit of appeasement behaviour there. And she turns round. And I'm going, are you okay? Do you want me to have a look around here? And she's going, not too sure, mummy. So you can just see there that I've moved the Photizo away, and I've moved to a different technique which I use with a lot of dogs, including my own, and that's bathing with the Photizo. So Lily isn't going to be getting an acute dose of photobiomodulation. What she will be getting is a very small dose, but kind of more from a behavioural aspect, so one to help her relax. She does then come back and offer me a little bit more. So again, I've gone back into the bathing of the area. We have to remember that when we're using Photizo, we will inadvertently be working with acupressure points, and for whatever reason, that could be pain, it could be anything really, and she's going, nope, stop doing that, I don't like that. But she does seem more settled with the bathing. One of my favourite things to do with any dog with any condition, so not just Luxating Patella, is to bathe their feet. It's full of acupressure points, fantastic for reflexology, and you've got to imagine the nerves in your dog's body, they're like little fibre optic wires, so they'll be transporting the healing properties of that light further up the limb. So, oh, and there you go, she's let me do the other side, but she's gone, do you know what, mum, I don't want acute doses today, I just want to be bathed. And that's absolutely fine. You've got to work with what your dog is presenting. She's very clearly presenting areas for me to work on, but just not wanting those acute doses. So in this video, you've kind of got 2 different aspects there of how to work with Luxating Patella and Photizo for when your dog does want acute doses and when they just want to be bathed as well. I mean, I'm totally biased, but look how cute she is, even if her hair does look slightly messy. So what I'm doing with my left hand there is I'm just giving her a little tickle, a little bit of myofascial stuff. But really be guided by your dog. Your dog could sit there for the next 20 minutes and just want to be bathed. But you can see that Lily, she's okay with the bathing, but she does need that reassurance from me. We still carry on with the bathing. I do try and creep it in a little bit closer because I've got a test, and she's like, okay, I'll let you do it a little bit closer, just so we can try and get an even job. But again, don't worry if you don't get that even job.
Pardon? All done. All done. You shake it off. Yeah, good girl.
And then here comes the cavalry.
Oh, Rodney. Rodney. Thank you. Thank you. Oh, you are Oh God, the whole party's here. The whole party.
The main things to take away that when we are working with Luxating Patella is work down the spine, and then you want to go just over that pelvis and then start concentrating on that stifle. So say this is the stifle, we want to go all the way around with the Photizo, making sure that we are paying attention to the hips and the feet and the spine, but the main focus of attention is going to be in the stifle. If you have a higher grading of Luxating Patella, so say that right hind limb, your dog has a grading of 3 or even 1, to be honest, have a look at the shoulder or the forelimb opposite that joint. Make sure, does your dog want to be palpated in that area? Obviously we're working on consent-based treatment only, so don't, force your dog to and start stretching things about. That's something that can aggravate a situation. But are they receptive to the Photizo in that area? Be guided by your dog. I hope this video has been helpful. If you've liked it, make sure to comment, share, subscribe. I literally don't stop talking about canine pain, and I hope this is going to help guide you using your Photizo for Luxating Patella. Lots of love to you and your dogs. Take care for now. Bye.